And do we have any other questions from the audience? You know, I would like to. I noticed there's people from the Jakarta government, yeah, the province of Jakarta, from the Ministry of, or the health agency or health department, yeah. Obviously, Jakarta is the most advanced city in Indonesia. How is the landscape or the current status of digitalization in healthcare in Jakarta? And how would you see this type of initiative in preventive healthcare as a solution? Maybe one of you can represent. Why don't you all stand from the government of Jakarta, the agency, yeah? The agency of health agency, yeah. But dalam bahasa Indonesia juga nggak apa-apa. But if you want to be in English, it's okay.
Yeah, I'll try in English.
Yeah.
My name is Opi. I'm from government of Jakarta, and in Jakarta we have called SIXCAP LDH. It's for the nurse and the doctor go to farmhouse. Ketuk pintu layani dengan hati. They go from house to house and they check for the critical illness like hypertension or diabetic mellitus. They bring the tools, and it's just in Jakarta, not in the other place, and that's all I think.
And how do you see the status? Is it still manual, or is it beginning to be moving to digitalization?
Yes, it's still manual, and then I think from the Dr. Kusmedi is our government, and they will change to the technology. I think then the nurse or the doctor bring the something tools to by the technology. And sorry, I have a question.
Please.
Okay.
Please.
And then my question is how you to promote this application? Do you have plan for that? Because I think this application is very good, but it may be useless if you don't have good promotion. Okay, thank you.
Okay, so I'll allow Mr. Cliffley to answer that question from the health department of the government of Jakarta.
What's the question?
How do you promote the application?
How do you promote the application? I think we've built it with features that I think are useful and valuable for the user. So to be able to take control of your own health data, your own clinical data, to be able to share that securely with people that you want to show that data to, whether it's a loved one or a provider, to be able to complete behavior change programs that will allow you to achieve your objectives, whether it's to lose weight, whether it's to eat better, or whether it's to manage your chronic diseases better, diabetes, Parkinson's, etc. So all these are valuable solutions that we've presented in an app that is playful and fun and doesn't remind you that you're sick. I think that's important. And then on the flip side, the information that we gather can be anonymized and analyzed at the population level. So there's value for the provider organizations and the payer organizations and the governments as well to be able to analyze that data, because at the end of the day, those insights will help you determine what types of policies to put in place. So that's more of a that's the thought behind how users, both on the patient side as well as the provider side, payer side, will adopt the solution. If your question is more around marketing, I think everybody hopes that it'll go viral, right? I mean, that's the best way to achieve adoption. But short of that, we do have traditional marketing campaigns that target students with certain messaging. We can target more patients with chronic diseases with a different messaging, and so on.
I'd also like Dr. Andre Meliala to comment on how you're going to promote, because This particular application is developed with the University of Gajah Mada, and so it's an Indonesian made and developed application. And so how are you going to promote this to the community, maybe to institutions and to government agencies, please?
Okay, thank you, Pak George. So in terms of promotion, I would like to say that this is how we endorse this for the users. And we have to see that the users is not only the people or the community, but also the payer, and also the district health office or provincial health office of the Ministry of Health itself, and also other institutions. Why? Because first, in the primary care level, we can help the people how to manage their healthy behavior. And this is very important as well for the primary care services, because they can interact and they can communicate when there's something wrong. And within this package of benefits, I think the promotion will be very easy. Once you try this application and you know how to utilize this, and you can sense the benefit of it, so you will adopt it. And also in terms of higher service level, I will say that first in the hospital. So they can also engage with the patient more closely. Why? Because they don't have to call and they don't have to send an email or something, because the communication now is routine basis. And they can interact in a very synchronous manner, timely. And for the payer, because they have to pay a lot of money for chronic disease, because of lack of adherence or compliance of the patients. They don't take the medicine timely. So with this application, they can make a contact. They can also see the doctors whether they do the health promotion or prevention program in the field. And the payer also can monitor the status of the population, the health status of the population in a very specific way, whether the glucose or the cholesterol or things like that, the risk factor of some kind of severe diseases. So they'll be very happy to have it. So I think we're not going to have some kind of promotion like other things. This is academic things. This is a scientific application. And if the people have known the benefits, so they will adopt it. Thank you, Bachor.
Thank you. So I give back to the audience. Any comments, questions? Okay, we have four. So this round is 4 questions. We'll go straight 4 questions. Mungkin Ibu dulu, yang Madam at the back, and then Bapak, and then 3, 4. Yeah. So Ibu, please. So please make your comment or question, and your name and background.
Okay, thank you. My name is Lina. Thank you, and I would like to congratulate everybody for such fine initiative for making this application. Okay, just downloaded the application just now and try it for a while. So the first thing strike me is that this is just from the user experience. Just use it for a couple minutes, so I'm not represent the whole idea behind the application. So actually, what I would like to ask is that, what is the purpose of making this application? Because it's not shown in the application itself. So if I am a consumer or a patient, when I go into the application, I don't really, I would like to see what is the application added value for the customer or for me. Let's say, for example, that's number 1. Number 2 is that just now the panel mentioned about the stakeholders, including the consumer, healthcare provider, policy makers, and I probably this is just the beginning of the application, because it's not yet shown in the application what is the future plan will look like. Correct me if I'm wrong. And the other one is that what struck me is that in the medical society and patient-doctors relationship, there is so-called confidentiality. So how you can ensure that patient confidentiality being protected in this application? I'm not sure there is a law on the web-based patient data confidentiality. Probably we need to update our regulation to keep up with the technology update. Now, what we have now is a very much manual or written patient confidentiality. So how we can ensure that, and how we can ensure that the person or the one that get our data sign the confidentiality agreement. Okay, thank you very much.
Thank you very much. I'll allow Cliff to answer the first two, and then maybe Dr. Lutfan to answer the third one, patient confidentiality agreement. So please, Cliff, the first and second one is basically the user experience and then the future plan of the app.
Sure. So the intent of the, well, first of all, I think you're curious to know what some of the key features are, and I'm happy to share. So, you know, one key feature, well, I'll share two. There's a behavior change program. So when you think about programs where, you know, we can screen individuals for early symptoms of disease, you know, hand tremors might be a good one to use that as an example. So what does that indicate? If I can screen you over the course of 6 months and you know, track that your tremors are getting worse, what does that mean? It could mean that you've had a small stroke. It could mean that it's early Parkinson's. It could mean that you've got thyroid disease. It could mean several other things. So this is where, you know, we're able to encapsulate the knowledge of medical professionals and deliver that as a digital screening solution to segment the population. And once we're able to segment the population, whether it's by hand tremor, whether it's by you know, early smoker, late smoker, diabetic, whatever, I mean, the possibilities are endless. But the idea is that we can segment the population at a broad level, because this is a national app, and then start to identify what we can do to intervene. Okay. But I think, you know, one of our tenets is to create this not as a you know, a stiff medical app. So we'll disguise some of these challenges as games. So you may be playing a game, but in the background, you know, we're monitoring whether or not you've got hand tremors. And you play the game over 6 months, and you know, we can track that for you. And it's not just based on the one data point, right? If we suspect something, we'll add another screening challenge to your regimen, and you know, we'll make sure that you know, there's some level of confidence before we recommend that you go see a medical professional. So, so there's that aspect. The other aspect is that you can take control of your health data. So we've integrated with UGM Hospital, whereby you can request, with your consent, the import of your lab data. So you can start to visualize that lab data within your app. We've also included other security measures, such as a password to get into sensitive data within the app. Because if you don't have a lock on your phone, anybody can pick up your phone and start to look at your stuff. So where there's sensitive data, there's always a password that only you should know. And as far as roadmap goes, you know, I love this question because you know, at the end of the day, what we want to do is have a solution that is predictive. We can, as a country, predict where health patterns are going, who's trending up, who's trending down. When I say who, I mean segments, not individuals. That way you can start to identify policies and programs and allocate, budget and resources to tackle those problems. So, the roadmap for the individual would be to continue to collect individual data points, whether it's interaction through the phone, whether it's the touch screen, the microphone, the accelerometer, the camera. I mean, there's so many options to be able to capture symptoms. So we'll continue to present those as fun challenges, but in the background we're capturing symptoms or potential symptoms and starting to interpret that. So the algorithms that we create and continue to refine should be the algorithms that will provide the insight for the provider community, the payer community, as well as the government at the population level.